Honorable panelists, respected audience, I am Dr. Sakila Israt Jahan, here to present primary cardiac tumors in pediatric patients, a single center experience. Primary cardiac tumors are very rare in pediatric population. The majority in children are benign, about 90%, and among them, rhabdomyoma is the commonest, and followed by myxoma, teratoma, fibroma, etc. It was a retrospective single-center study. Total 9 patients with primary cardiac tumor operated in NICVD from January 2008 to December 2019. All surgeries were performed by median sternotomy, and the aim of the surgery was to resect the entire tumor mass with sufficient margin. And intraatrial septum was incised and repaired where required with autologous pericardial patch, and we did in 3 patients in our series. Among 9 patients, 5 were male and 4 were female, and the age ranges from 4 to 11 years and weighs between 10 to 20 kgs, presents with different symptoms like dyspnea, palpitation, and the most common site is the left atrium, followed by right atrium, and one found in the right ventricle, which at the septal leaflet of tricuspid valve. And the all tumor reveals myxoma, which is confirmed by histopathology. And the most common approach in our study is biatriotomy, and the average cross-clamp time was 34 minutes. The majority of tumors in adults are secondary, which arise from non-cardiac tissue, either invading or metastasizing to the heart. And this is common in adult. And while the majority of tumors in pediatric populations are primary, and the primary cardiac tumor are asymptomatic in up to 12% cases. And in our study, the asymptomatic percentage is 22%. And the echocardiography plays a very important role in the diagnosis of cardiac tumor. Surgical approach, either by transatrial, transventricular, or transaortic, depends on the mass position. Surgical resection in the operation needs gentle manipulation of the heart to prevent embolization. The pathological examination in excised mass showed myxoma in all patients, and the most common site of mass is in the left atrium, around 66%, followed by in the right atrium, around 22%, and interestingly, one mass found in the right ventricle. And we had a family history of myxoma in 1 case. Familial occurrence of myxoma are around in 7% cases and mostly in the younger patients. Cardiac tumor. Cardiac tumor include benign and malignant neoplasms arise within the cardiac chambers or in the myocardium. Columbus first recognized it in 1559, and excision of LA myxoma with cardiopulmonary bypass was done by Crawford in 1954. Broadly, the tumor classified into primary cardiac tumor and secondary cardiac tumor, and the secondary cardiac tumor is the commonest in adult population, and among primary cardiac tumor, benign is the commonest. These are the relative incidence of primary cardiac tumor, and in adult population, myxoma is the commonest, where in children, rhabdomyoma is the commonest, and it is most common in the infancy. And in primary malignant heart tumor, angiosarcoma is commonest in adult, and malignant teratoma is commonest in children. The patients with primary cardiac tumor may present in 4 ways. Patient may present with systemic manifestations like fever, fatigue, weakness, or may present with embolic manifestation, mostly by the left-sided tumor, or patients may present with cardiac manifestations like chest pain, dyspnea, orthopnea, edema. If the patients have a metastatic heart tumor, patient may present with symptoms of primary site. Color Doppler echocardiography is the important diagnostic tool. We can also do TE, 3D echocardiography, CT scan of chest, cardiac MRI with contrast where needed. This is a picture of distribution of mass according to its attachment site. It was taken from a study of 75 consecutive patients of primary cardiac tumor, where we can assess the tumor by its site in the heart. Take-home message. Cardiac tumors are rare but can be managed surgically with very good prognosis. Though rhabdomyoma is the commonest tumor in pediatric group, we found all myxoma in long 12 years in our series. This may demand large-scale study to sort out any difference in our ethnic group. Thank you. We are celebrating National Children's Day. If we are able to done 100% congenital cardiac cases in affordable cost, that would be the best gift to him in this day. Thank you all.